To operate with precision, we must establish a coordinate system. In engineering, we use axes. In anatomy, we use planes. These three geometric slices allow us to describe every movement and every structural relationship with zero ambiguity. One, the sagittal plane. This plane divides the body into left and right portions. Median mid-sagittal, an exact split into equal halves. Parasagittal, any offset split creating unequal portions. Mechanical context, this is the plane of forward and backward progression. If you are performing flexion or extension, you are operating within the sagittal plane. 2. The frontal plane coronal. This plane divides the body into anterior front and posterior back portions. Mechanical context, this governs lateral, side-to-side displacement. Movements, like abduction and adduction moving a limb away from or toward, the midline exist here. 3. The transverse plane horizontal. This plane divides the body into superior upper and inferior lower portions. Mechanical context, this is the plane of torque. Any internal or external rotation of a segment occurs along this horizontal axis. To summarize it, let's strip away the complexity and view the body through these three slices. Sagittal, left or right forward motion. Frontal, front or back side motion. Transverse, top or bottom rotational motion. Establishing these planes is non-negotiable. Without them, you cannot accurately communicate the direction of force or the orientation of a structure. Use these as your primary reference points for everything that follows. To translate anatomical planes into physical action, we use a specific vocabulary of movement. These terms allow us to describe the dynamic displacement of the body's levers with engineering precision. Sagittal plane movements. These occur along the forward and backward axis. Flexion, a movement that decreases the central angle between two body segments. Extension, a movement that increases the angle, returning the joint to its neutral alignment. Hyperextension, extending a joint beyond its standard anatomical limit. Frontal plane movements. These describe side-to-side displacement relative to the midline. Abduction, moving a structure away from the body's midline. Adduction, moving a structure toward the body's midline. Transverse plane movements. These involve rotation around a vertical axis. Internal or medial rotation, rotating a limb toward the midline. External or lateral rotation, rotating a limb away from the midline. Circumduction, a complex, conical movement that combines flexion, extension, abduction, and adduction into a single circular motion. Specialized movements, forearm and hand. The forearm possesses a unique rotational capability. Supination, rotating the forearm so the palm faces anterior, which is forward or up. Pronation, rotating the forearm so the palm faces posterior, which is backward or down. Specialized movements, the foot. The ankle and foot operate on specific axes to manage terrain and locomotion. Dorsiflexion, moving the foot upward toward the shin. Plantarflexion, moving the foot downward, as if pressing a pedal. Inversion, turning the sole of the foot inward toward the midline. Eversion, turning the sole of the foot outward away from the midline. Scapula, jaw, and general positioning. For structural elements, like the shoulder blades and the mandible, we use linear displacement terms. Elevation, moving a structure superiorly, which is upward. Depression, moving a structure inferiorly, which is downward. Protraction, moving a structure anteriorly, which is forward. Retraction, moving a structure posteriorly, which is backward. Mastering these terms is essential. They are the coordinates of human performance. Whether you are analyzing a squat, a punch, or a surgical procedure, these are the only words that matter for describing the trajectory of motion.